Well, welcome to episode 4 of Triangle Dentistry Talk. I am your host, Dr. Carl Bernstein, and we are here today with two amazing women. They work at and own Little Tooth Co. in Apex, North Carolina, and we're here with Dr. Cyelee Kulkarni and Dr. Jean Yu. How are you guys today?
Doing well. Good
Great. Thank
morning.
you so much.
Thanks for having us.
Yeah, well, we love having you. We're here on a Saturday, so they're taking their weekend, spending some time with us, trying to have a little fun with the podcast. And so right now, what we're first going to do is try to get to know a little bit about each of these doctors. So either Cyelee or Jean, whoever wants to go first, tell us just a little bit about yourself.
Sure. Well, thank you, Carl, for having us. This is pretty fun and awesome. I can't say that I've done this before, although I'm a pretty avid podcast listener myself. Um, I'm Dr. Jean or Jean Yu, and I've been in North Carolina since 2019. I went to the University at Buffalo for my dental school training. Then I completed my pediatric training at Columbia University, and then moved down here after a couple of years in private practice. And I've been at Little Tooth Co. ever since we moved down here.
Now, that's New York through and through. Is that where you're from as well?
I am. I'm originally from the New Jersey, New York City area.
Now,
Um,
where did you go to undergrad?
I actually went to Ramapo College, like small, a small liberal arts college, like 10 minutes from where I lived. Or 10
Now,
minutes from where I
obviously,
grew up.
New York people can be very sports fanatics. Are you a sports fan by any chance of
No,
either?
I can't say I am. Do you follow any sports teams up there?
I do not. I am from Cincinnati, so I
Oh,
am a
cool.
fan of the Bengals, a fan of the Reds. Most of the time, we don't have much to watch or root for most of the years, but the Bengals are doing pretty good. So now I've been following that a little bit more. But it's I do like to watch sports, but you know it's hard to find time, especially as we get older. But definitely
Mhm.
big sports fan here. But New York, obviously everyone is kind of rooting for or following the Jets at this time with
Mhm.
Aaron Rodgers being there. So I just didn't know. But it's where when you went to dental school, you said that was Buffalo.
Yes, that was
And so
Buffalo.
you're not a Bills fan? You didn't pick up any Bills fanatics there? They're huge fans.
I did go to one or two games. I was focusing on my studies.
Well, that's good. Yeah, that's good. Cyelee, go ahead. Tell us a little bit about yourself.
Well, thank you for having us, Carl. I know this is such a fun thing to do, and I like Jean. I've never done this before, but I'm happy to be here. But yeah, I went to dental school at Penn, so I was in Philly for some time, and I I did a 1 year residency up at Harvard, and then I went to Sloan Kettering, did some cancer research there, and then I did my pediatric residency at Montefiore Hospital, at in the Bronx in New York. So I was in New York City as well for a while. I did some private practice in between, and I taught for many years back at Penn. I went back to my alma mater. So I was the director there for 4 years. And then I came back to Monty and taught there as well. So I worked with the residents for some time. And I moved here about a year and a half, almost 2 years ago. And Jean and I met, and it worked out really well. So we've been together since then. I joined Little Tooth Co. Back in 2022, and things have been great since then. So we're enjoying our time in North Carolina now.
So it sounds like both of you girls are big city people. So how are you enjoying your time in Cary, North Carolina, or where do you guys actually live in the area? But this is I kind of consider Cary, Raleigh, Durham just like a large suburb. How is the change?
We actually cover both sides of the triangle because Cyelee is in Durham and I'm out towards Raleigh. So we're coming from opposite ends and going to work in Apex. I like it. I think, once, at least for me, once we were ready to have kids and kind of settle down, it was just a natural sort of change. Even though I grew up near New York City, I've never quite been a city girl. So I was kind of excited to be leaving, if I'll be honest with you.
Yeah, I'm also in the Durham area as well, so like Briar Creek by the airport. So I definitely I work in Cary with my office at Bernstein Orthodontics, but it's I do like living a little bit further than where I practice.
Yeah, I'm in, like Jean said, I'm in Durham, and it is a little bit of a commute down to Apex, but I also, I kind of like having a little bit of space there, and I get to see a lot more of the area. I did spend a lot of time in New York City, but I grew up in a small town actually. So this feels, like Jean said, feels natural, and especially with two kids, the space is great compared to a New York City apartment. It feels nice to be able to spread out a little bit. So pretty happy here.
Yeah, definitely get a lot more. The weather's also a little bit better, so this
Yes.
area is
Yeah,
just
for sure.
growing like crazy. Obviously, everyone knows of it now, but it's but let's kind of step into a little bit while we're here, which is to kind of learn about your office, which is Little Tooth Co. Do you guys ever get people calling it Little Tooth Company?
We do. Yeah, we do.
That-
It's
I'm not
pretty
gonna lie, that's
natural.
kind of what I thought it was originally called, and it was
Mhm.
just an abbreviation in the name. But I love the name Little Tooth Co. I think it's awesome. It's really cute. But tell us a little bit about your office.
Oh, well, thank you. Our office is in Apex, North Carolina, right off of Highway 55. We have an amazing team that we work with. I think we're going on 12 wonderful women that we work with, and we're currently hiring as well for front and back. What I love about our office is that I think everyone comes to work with the same goal of trying to put their best foot forward and truly give every child the most positive experience that they could have. Cyelee, what do you think?
Yeah, I mean, I've been at a lot of places, and I feel like this particular office has a real sense of family and community. I think we work really well together, and everyone, like Jean said, has the same goal, and I think that's important. So um, I feel like every patient we try our best to take care of as if
You
they
know,
were family.
Yeah, I've been to their office a few times in Apex, and one thing that always sticks out to me, and I don't know if you guys even still have it, is you always had these photos that were like colorful animals, and their
We
office is
do.
really, really cute. I think it's fun. I think if you go in there, just the atmosphere already, just by walking in, you feel really comfortable. And I think I've only been there a few times when patients are there, but kids are always smiling, laughing, have a good time. I think you guys give balloons to patients as well.
We do. We give balloons.
Balloons are always
It's the
fun.
little things that make them,
Yeah, it is.
their faces just brighten up.
Yeah, the little things are what make, kind of give that special touch, make you feel comfortable with where you're at. And everyone always is a little bit nervous going to the dentist. And so you
Mhm.
want to feel really comfortable, and any little additional touch makes it a good experience for parents and kids. But, tell us, so we're learning a little bit about your office. You guys mentioned that I think you have about 12 staff members, always looking for more. The area is growing like crazy, so there's always more kids coming and always more patients in need of care. But an office, what makes it move, we have a limited doctors there, one, two, or three. I don't know how many you guys have in total, but it's the staff that makes the office really go. It gives it that unique experience. So just tell us what makes your staff so special.
I would say that each person brings their own strength to work each day. So a lot of our team members are super bubbly and personable, and then other team members are a little bit softer, a little more approachable, and I think that helps to cater towards all the different temperaments that children can come in with on any given day. I also think that everyone is really driven to not only do their best for the children, but also keep the office in the best condition that they can. So everyone's very passionate about keeping the office clean. They make that a priority, as well as contribute to ideas. We love to hear ideas from the team about, what new fun things can we add to the decor, or to the prizes that we give out. I think that excitement and that passion for what they're doing is what contributes to overall the best experience.
And I think if you guys listened in the beginning, I think we have two Ivy League alumni, here. I think one was Penn, one was Columbia. So you got definitely the best education, probably some of the smartest doctors here in the area. So whenever you go, you're gonna get the best knowledge, updated information from them. So I think that's another little touch that people don't really experience or get to know exactly by just looking at them. But these are some two really intelligent people that we have here with us today and working at Little Tooth Co. Tell us, a little bit about dental treatment. Pediatric dentistry, obviously we all know about it. We're all dentists here, but sometimes I don't think people understand, exactly what the biggest benefit a pediatric dentist may offer. Obviously we know that's kids that they're treating primarily, but what is the big benefit of a pediatric dentist?
I think the way I often explain to many of the patients or many of my friends who maybe don't go to a pediatric dentist is, in the same way we take our children to a pediatrician because they're educated in pediatrics, they're well trained in pediatrics, we are as well. So dentistry varies so much based on what's needed by each patient. And I think in pediatrics, it takes a special subset to be able to handle the challenges and the special qualities of children. And so just like in the medical world where pediatricians are trained very specifically in the care of children, we are also. So it's not that we're simply doing dentistry on small adults, we're doing them on children who are different. And that involves among many things, also things like anxiety management, behavior management, because we expect children to be of different temperaments and have different anxieties coming into the office, but also with things like growth and development. How does it affect what is involved? How do these teeth and how does their mouth grow based on what we're doing? And so it's a big picture overview. So it's not simply a tooth by tooth kind of treatment. We are looking at the whole child and their entire growth and development. So I think as a community of pediatric dentists, but also just as an office, we do this really well. We can take care of kids at different stages of development.
And what is that age group, or what is the age that you really want to start seeing kids to come into the office? And then when do you really, at some point, obviously you are a pediatric dentist, when do you dismiss patients from your office and say, you've reached the age of maturity, it's time to start moving on to a more long-term dental care office?
That's a great question. So we follow the guidelines set forth by the American Academy of Pediatric Dentistry, or we call it the AAPD. And the official recommendation is by the time the child has their first teeth or before the age of 1. So for instance, my soon to be 8-month-old just sprouted his 2 bottom front teeth. So technically we are brushing now and he should see Dr. Cyelee in the office sometime soon. And then as far as graduation, we like to line it up with high school graduation. I feel like that is a pretty natural transition in life where a young adult will go out and go to college or move out of the home or start their first real job or trade school or something like that. So usually we'll line it up around age 18 or when they're graduating high school. With that being said, if they or their parent feel that they're ready sooner to go to the adult dentist or the general dentist, that's perfectly fine. We do have some special needs friends that ask kindly if they can stay a little bit longer, and as long as we feel that we're able to meet their dental needs, then we'll keep them around for a little bit longer, and we'll take the time to find them the right new home, if that is the case, for when they eventually do outgrow the capacity in which we can care for them.
I think one thing Cyelee had mentioned in just a little bit ago, obviously apprehension and maybe anxiety or fear with the dental office. And that's one thing pediatric dentists are really good at coping with, really good at maybe helping calm your child down, if you want to say it like that, or help them understand that there really isn't a true need or true reason to have high anxiety. But I think one thing we sometimes forget is parents, especially and more in today's time, that anxiety for parents is high, and they're more sometimes concerned than even their kids are. And I think that's one thing that a pediatric dentist is really able to help explain with to the parents. But what would you guys say to that? What would you say, Cyelee, in how you guys deal with that?
I think, I mean, especially as a parent, I think it's completely normal and natural to be anxious for your child or on behalf of your child. I often will tell parents, you are the most important person to your child, and so your actions, your fears are going to be reflected on them. And so, in some ways, it's important that you are happy in this office. And so, I do want the parents to trust me as a provider and as a doctor for their child. And so, I hope, and I definitely try to take as much time as I can to show the parents what it is that we will need to be doing to take care of their child in the best way possible. I do think it's important and age appropriate for children to have someone near them that can comfort them and things like that. So in some families, it works really well to have the parents next to them during treatment and with them during care. And we absolutely encourage that. If it doesn't work for your family, that's also okay. I mean, I'm willing to work with what works best for the child and for the family. But we certainly allow parents to be with the child during treatment as long as it provides safe care. There are some exceptions to that when, for example, in a sedation setting where it may not be safe to do so. But otherwise, we want the parent to feel comfortable because it makes the child feel more comfortable. And I think I often tell the parents, you should put on a brave face. You need to show your child that this is a safe place to be. You wouldn't take your child to a place where something would happen. And so they feel that trust and that safety because of them.
And that was good to hear. Some offices I've heard, and everyone obviously has different protocol at their office, but it definitely sounds like you guys let parents come back, sit with them for pretty much most or all the appointments. But there could be some times maybe that they're just not able to be exactly right next to them. But you do allow parents to come back for all their appointments.
Oh, absolutely. I think I speak for both Cyelee and myself and everyone at our office that we treat the children and the families as if they were our own family and our own kids. So for me, I like to go to all of my kids' visits and go back with them and hold their hand or have them sit on my lap. And so I would never deny that to another parent if that's what they wanted. Of course, parents of older kids or, maybe they're working through independence, if they want them to go back by themselves, that's totally fine too. We do have some parents that come in with their laptops, they want to get some work done or they got to hop on a call, and totally fine with us. And other parents that want to sit as close to their, maybe sit near their child, but without interfering with the things that we have to do and hold their hands. And we encourage that as well, whatever it takes to make the child feel comfortable and for the parent to trust us.
So you talked about possibly, types of treatment, how to, in the sense of care for some anxiety. And do you guys do any sedation in the sense of, I guess there's obviously people know of laughing gas. Do you do anything more additional in the sense of sedation wise?
Yes. I mean, so I think as pediatric dentists in general, sort of our biggest option is we do behavior management, meaning, and that it often involves the general atmosphere of the office and the way we're going to speak to the children, different ways of doing that. So that's sort of the biggest piece of it. That's not sedation, obviously, but that is, I think, the biggest piece of management of a child. But like you said, in addition to that, there are other ways to manage anxiety and difficulties with treatment in some cases. And that can vary from case to case why we do those things. But we do offer nitrous oxide, which is laughing gas for the child, to help with anxiety management a little bit. It can also help with things like gag reflex and things like that. So there are various reasons why we could use that. We do also have the option of using, again, if safe, things like Valium, where they may have a little bit more anxiety and need a little bit more ability to calm down. And then our sort of deepest level of sedation that we offer is general anesthesia, and we do that with an anesthesiologist. So I tell my patients, you don't want me doing this. I'm not an anesthesiologist. You want someone who's trained and capable to do this and doing this the best way they can and that does this for a living. He does the anesthesia part of it for us. And then Jean and I do the dentistry. So we can that way focus on our strengths and let the child be the safest possible.
Well, great. That's good to hear. And it's, as you guys are all here, and, Little Tooth Co. essentially offers every treatment modality and every treatment, and can cover every treatment need for pretty much all pediatric patients in the area. But let's on a little side note, I know pediatric dentists, always have kind of kid terms, funny terms for, sleepy juice. They got laughing gas, and they have other names for their instruments to make you feel comfortable. What are some of those names that you guys use for your instruments and for helping patients cope with some of that?
Well, Carl, we have a new modality for administering local anesthesia. It's actually an intraosseous administration. So the days of the lip, the tongue, and the cheeks being numb and potentially getting bitten in that time frame are gone. So we now
Oh, that's
call
awesome.
the local. Yeah, it's really amazing. And it's a more compassionate way of administering that numbing medicine. We call it, or at least I call it, the thermometer, because it kind of looks like a thermometer. So it's no longer the sleepy juice.
You see, I
Yeah.
unfortunately, when I was a kid, I didn't do the best job brushing, so I had a lot of cavities as a child and some baby teeth taken out. So there's nothing wrong. If you have any issues, don't feel embarrassed, especially parents. Everyone always runs into issues. Sometimes we think brushing is doing great. Obviously, my mom thought I was brushing really well, and I wasn't doing that good of a job. So it can happen to anyone. So obviously, go into your dentist, get that regular checkups. What do you recommend for the regular checkup times? How many times per year? How many times do you recommend to brush, floss? What are those recommendations?
So in terms of how often you should come see us, most people come to see us every 6 months or so. It's about twice a year. That's sort of our typical schedule. There are kids who need this a little bit more frequently, and that's sort of dependent on your child and what their needs are and their risks and things like that. So, but I would say most of our patients are on a 6 month schedule, so they come to see us every 6 months. In terms of how you take care of your teeth at home, you should be brushing daily, twice a day, morning and night. The flossing ideally once a day at least. The I I often tell parents, so I'm a mom and I get it. Life happens and it's hard, and so there's going to be some variation in this, but all you can do is the best you can do. And these are the goals that we set, and this is what we hope for, and this is what's going to give us our best chance to keep those teeth nice and clean and healthy. But these are goals and these are patterns to build. So twice a day, morning and night, and flossing at nighttime. I often tell parents that also that brushing your teeth is hard, and flossing is particularly hard. I mean,
Yes, it
there's a
is.
lot of hand-eye coordination that goes into this. And like you
Yeah.
said, mom thought you were doing a great job, but clearly, things were happening, and a lot of this is you're not able to do that. So handwriting is a good rule of thumb. So most kids are not able to fully take over by themselves until they're somewhere between 6 to 8 years of age. And even then, some kids need a little longer, and some kids need a little less. So be ready to be involved in your kids' daily patterns for a while.
And I'm glad you said that, because we always get that a lot, even here at the orthodontist, and we see patients that are, more primarily kind of just starting their teen years, 10, 11, 12, 13, 14, and obviously younger and older, and adults as well. But one thing that we always see, if person's having a maybe bad brushing throughout their treatment, parents always ask, should I be brushing my kids' teeth even if they're now already 10, 11, 12? And I say, go, if they're not doing a good job, go ahead, show them how to do it. And then they should be able to learn and take over. But you kind of mentioned, 6 to 8. I think parents always maybe get a little confused. Everyone wants their kids to have some more autonomy, especially nowadays. But is that kind of that gold standard, that 6 to 8, or is it, obviously it changes, everyone's different, but what is your recommendation on, parents brushing their kids' teeth even a little bit older, or even younger kids already starting to brush their teeth really well? Is there something that you say, look for this exactly, and they're doing a great job? Or, that's always a tough one to let them take over, because, me as an example, I obviously did not do a great job, but, I figured it out at some point. You just don't want to figure out too late.
Like Cyelee said, it really is case dependent, and that's where going to the dentist regularly kind of helps out with that. We do we do a or cavity risk analysis, and based on that and how the child's hygiene has been prior to them coming into their visit and getting their teeth cleaned, that's going to help us in making a personalized recommendation for each child. I would say 8 years old is. I'm not sure about you, Cyelee, but I usually say about 8 years old for the parent to at least be monitoring and maybe have a turd and verifying that every tooth was touched by the toothbrush. Um, and then really some kids are kind of able to do it on their own, maybe a little bit earlier, and then others a little bit later. It really is about establishing those good habits. And with that, every child also has a different habit as far as their diets are concerned. So within one family, you could have the sweet tooth who wants to eat all the chocolate and all the sweets, and then the other one who, just eats all their fruits and vegetables and does all the right things, right?
Exactly. Now, do you recommend, a lot of the times, they've been around forever, electric toothbrushes. Now it seems like they're not anything new. And there's a lot more companies than Invisalign or than Sonicare and Oral-B, except those are still the ones that I know the most and have recommendations for with patients. But what would you guys say in the sense of manual toothbrush versus, an electric toothbrush, if it's Sonicare, if it's Oral-B, or if there's other ones that you guys know of? I haven't looked into them because those two work pretty well.
They do.
I mean, those are great. I often, I tell my patients the best toothbrush is one that you will use.
Yes, exactly.
And if that means manual, then that's fine. I mean, my 2-year-old sometimes absolutely hates her electric toothbrush, and so I will take a manual and do that. So I'd rather get something than nothing. Um, I'm also kind of lazy, and I feel like the least amount of work I can do is probably, the thing I'm going to do more often. So I think an electric toothbrush is a really nice way of being able to do this a little bit more consistently with a lot less effort than a manual toothbrush takes. So can you get a good brush with a manual toothbrush? Absolutely. But will it take a lot more effort and time? That's also true. So I think an electric toothbrush is a great option if that's available to you as a patient. I think Sonicare and Oral-B have been on the market for so long, and they're sort of known to be great options. But that being said, I think there are a lot of other options that are wonderful. I think I really don't think the battery powered ones are getting enough power to do what they need to do. So it has to be one that sort of is charged, because it doesn't have the same level of power unless it's one of those chargeable ones. We do keep one in our office. I think it's called Burst, and it's also great. And I think there's so many great options on the market now, but it really should be one that can be powered, sort of like charged on the wall kind of situation, and one that your child will tolerate and will like.
I know some of the newer ones of Sonicare and Oral-B will even they all have like Bluetooth technology and apps. And I guess if you really want to know if your kid is brushing, I know some of those will show where they're estimating kind of how long they're brushing, where they're brushing in the mouth. Obviously, kids are smart enough and can figure out how to fool you and not brush, but make it look like they're brushing with those toothbrushes. But if you're a parent and ever kind of concerned, I know those two bigger, Sonicare, Oral-B do have apps that let you see how long your kid is brushing. Maybe you may look at it and say, wow, you haven't brushed for 5 days. You may want to pick that up. So at least gives you an idea, but I know, there's some expensive ones and you don't need obviously the most expensive toothbrush out there. The cheapest ones can work just as well, but it's just something that if you're really concerned, I know those electric ones do offer some extra capabilities. Now, you guys mentioned you had for giving numbing, some new technology, but is there any new technology or other new technology in the pediatric field that you guys are utilizing? I haven't followed it. I don't know what's new in pediatric dentistry. This is the difference between a pediatric dentist, is they stay up to date. So right here, I'm a prime example of, why you wouldn't want to bring your kids for me to do their cavities and look at their mouth only, because I wouldn't give you that full treatment need. So, but is there any, new technology that is available?
Yeah, absolutely. We currently use the light scalpel laser for our infant frenectomies, so to correct tongue and lip ties. In addition to that, we also offer white crowns. So if the cavity is so large that we're not able to place a white or a tooth colored filling, then we can place different kinds of white crowns that would,
Oh, that's awesome.
closely match the natural tooth color as well. Beyond that, we do same day space maintainers. So if we need to save the space, maybe a baby tooth has been lost early and we're worried about crowding around that area from that early loss, we can place a space maintainer that day chairside without having to send it to the lab. Um, it's kind of hard to think because we do try to stay up to date. Am I missing anything, Cyelee, on that?
I don't think so. I think
Did I
we
mention
talked about,
everything? Yeah.
yeah, I think we also have the digital X-ray. I mean, digital
Yeah,
X-ray
I was
just
going
sort
to
of,
mention that. You read my
you
mind. Yep.
One thing
but
that you guys mentioned as well, or that Jean mentioned, is obviously tongue tie. Tell us a little bit of maybe a recommendation on when to have that at least evaluated. Maybe something that parents are able to look at home. Obviously, when it comes, some parents and moms are able to figure that out very early in their child's life. But what are some maybe things for parents to look at for tongue tie issues, and what is the benefit of having that corrected?
Um, if I may, I think that the earlier the better, and that's for several reasons. Um, Early on in life, the baby or the child hasn't yet learned how to fully use all of their oral muscles yet. They haven't developed speech. They haven't, started eating solid foods yet. So when the child is still nursing is the best time, I think, if the mother determines that something is not right. And we see that there's a physical tie, and we feel that there may be a benefit from relieving that tie or relieving that tethered tissue. The tissue is also obviously thinner. It's not as thick as when the child were to grow up and get older. So it's also a faster procedure at that point in time. When it's that small, being that we do use the laser, which is really nice. There's no need for sutures. We follow up every 2 weeks until the wound closes, and there's really minimal to no bleeding afterwards, which is amazing. Now, with that being said, if a toddler or a young child was having issues developing speech or was having feeding difficulties, we do often work with other specialists who will refer patients to us and say, hey, we've kind of tried everything. We're really not getting anywhere. I'm wondering if you can take a look and see if there's a physical tie that you think could be relieved, that could maybe help us move our progress along. And I will also say that we're pretty conservative with that. Wouldn't you agree, Cyelee? We're pretty conservative when it comes to diagnosing those. This is relatively new in pediatric dentistry over the past couple decades, and I do believe that there are plenty of people that have been able to compensate and walk around with tongue and lip ties. And so it really is, if we feel that there's going to be a functional benefit, that we would recommend having the issue addressed.
Well, that's good to hear, and that's always something that it seems like a little bit more frequent times that it's always been discussed more with tongue tie. So glad that you guys offer that to your patients and offer it in such a comfortable way as well. One thing that a lot of parents especially get a little concerned about is with orthodontics. It's always a large expense in their kid's life. And I'm an orthodontist. I have an office in Cary, not too far from Little Tooth Co. and at Bernstein Orthodontics. But how does orthodontics play a role in your office? What are the normal times that you're kind of referring patients to the orthodontist? Just to give you a little information before they answer. We always recommend, with kind of our American the Orthodontic Association is normally around age 7 is kind of when we start to see patients for orthodontic needs. And it's not necessarily we're hoping to do treatment, because we really aren't trying to do treatment at a young age. We really just want to make sure teeth are coming in the proper way, and making sure really the jaw shape is in a proper spot. It's in a proper width, proper dimensions. And really our goal is to try to make sure that as we start to age, our growth and development is following our normal guidelines. And so that's what, obviously us as an orthodontist, and me, is that's what, we kind of recommend. But, pediatric dentistry, they're obviously seeing the kids much more frequent, much earlier. And so how does orthodontics play a role? And obviously one big role that we talked about is brushing. It's one thing we are definitely concerned about with braces and brushing, but how does that play a role with just your office?
So this is obviously a big piece of what we look for. I defer to you, Dr. Carl, as well as all of my other orthodontic colleagues that to do the treatment and to really focus on what's necessary. But my role in this is that I'm evaluating the child from the very beginning to see if they fall into the category of, hey, is this something that we really need to look at? Or is this something that we can sort of monitor? Even at their very first visit, we're looking at tooth development in relationship to how the jaws are developing. Like you said, the width of the jaws, the space that's required, things like that. Very early, we can tell you, especially if the child is crowded, is this somebody who's going to need something down the road? And, at age 3, 4, when these primary teeth are in there, the baby teeth are in there, we can tell that they're pretty crowded. And we know that, hey, like, you keep this in mind. This is something that will probably be discussed in the future because your child falls into this category of somebody who looks like their jaws need to be evaluated at some point. My role in this, like I said, is to watch and to monitor and to refer when needed. I will often tell the parents that sometimes this is a real estate issue, right? Like we just can't get these teeth in there. There's just not enough space. And so while I can keep an eye on it and look at these teeth and treat them when they're there, I need my orthodontic colleagues to make the space to let that happen, whether it be because of tooth movement or because of bone movement. And because of that bone movement, we need to send you a little bit earlier. And I think some parents are hesitant to go when children are young, but I think it's important that they do go to be evaluated, again, not because they're necessarily going to be treated, but because we're going to be watching them to see patterns of growth and when that's necessary. Purely from our perspective, like what we do to intervene, I think space maintenance is an important piece of this. Holding that space, again, a real estate issue. Do we have the room to keep those teeth there? And when a baby tooth is lost for various reasons, you bumped it, there was a cavity, there was an abscess, etc. There's so many reasons why a baby tooth could be lost early. Our role in this is to sort of hold that space until our orthodontic colleagues can create more space. And so we do provide space maintenance for our patients when or if baby tooth is lost early and at the appropriate time frame. So if it's early enough that it's necessary, we'll do it. But we also watch for growth. And if they're old enough that tooth is going to come in pretty soon, we don't always necessarily have to put in a space maintainer. So it's sort of based on the child and their level of growth and development.
Well, that's great to hear. I think one thing, if you're still listening to this podcast, is, we, and especially Little Tooth Co., and every dentist, hopefully in the area, we're really lucky to be in Cary, in the Triangle area. We have wonderful dentists. We have a lot of dentists and every specialty to choose from, but everyone really should be getting individualized care. And that's what I think you're finding out, hopefully, with listening to this, is that each person, there is no standard way to treat everyone. Everyone is different. Everyone is unique in their own special way. And that's what our goals as dentists, and especially as pediatric dentists at Little Tooth Co., with Gene and Cyelee, they're really good at creating that custom plan for each patient, each family, to make it a wonderful experience. I think we're getting close to the end here. Is there anything that you guys would like to tell our audience, to give us any final words of wisdom before we head out for a wonderful weekend ahead?
Not really. I just wanted to say thank you again, Carl, for inviting us to be on this show with you. It's been so much fun. We love working with you, sharing patients as well. You take such great care of our patients, so thank you. And then for anyone out there listening or watching, if you're in need of a pediatric dentist, we'd love for you to join our family. We're always here, happy to chat, happy to meet you as well. And for anyone new to the area, welcome. It's a great place to be.
Yeah, I think
you'd like to add something?
Yeah, you guys will be. One thing before I let Cyelee, give her final words of wisdom, is definitely give Little Tooth Co. a chance. I think you will be happy go into that office. I think you'll be pleasantly surprised how much better pediatric dentistry and dentistry is in general compared to maybe when parents were kids. So, I think you'll have a great experience at Little Tooth Co. I mean, we got a wonderful time being able to spend 30, 40 minutes with these amazing dentists. They gave us and gave me some of their time on the weekend. So that's amazing. And you don't see that all the time. So obviously they are passionate. They love what they do. They love their patients. But Cyelee, go ahead. I don't want to not give you your time.
No, I think again, Carl, thank you so much for having us. This has been great. I think Jean covered it all, but basically we're so happy to be here, and we're so happy to have any families that want to come join us. We want this to be an open space and like a safe space for people. So we want you to feel comfortable and happy here, and hopefully that's the place for you. And if it's not, we're happy to find another home for you. But we want this to be a place where families feel comfortable to come see us. And we have so many wonderful offices in the area, like Dr. Carl's office. We see so many of your patients, and they're so happy to be here. We see that they've had such great results with you, and we're really happy to work with you in this sort of bigger community.
Well, thank you. I think, if you've made it this far, if you guys had any questions, if patients or future patients, if you had any questions, please feel free to ask me at Bernstein Orthodontics. If you wanted to, either give us a call, come in. If you wanted to go to Little Tooth Co. and you had a question and you wanted it answered, please ask them. There's always something that we're forgetting. We can always talk again. I know they would love to answer all of your guys' questions as well. Otherwise, it was a pleasure having Little Tooth Co., Dr. Cyelee Kulkarni and Dr. Jean Yu here today. Have a great day.